Hello everyone, this is Dr. Yaşar Başağa. I'm Doctor of Urology and Andrology. We have an andrology clinic based in Istanbul. Today I would like to talk about non-surgical treatment of premature ejaculation, which is selective dorsal cryoablation. What is selective dorsal cryoablation? We ablate some sensory nerves of the penis, and we are trying to control ejaculation sensation in males who are getting premature ejaculation. This has similar philosophy with the selective dorsal neurectomy surgery, but this treatment is for the men who are afraid of getting surgery and for the men who are getting premature ejaculation. As I mentioned before, the surgical treatment of premature ejaculation is suitable just for the men who are getting primary premature ejaculation. The most important difference between selective dorsal cryoablation and the selective dorsal neurectomy surgery, the first one is selective dorsal cryoablation is non-surgical treatment. Neurectomy is a surgical procedure, and the most important difference between them is selective dorsal cryoablation can be applied to men who inhale types of premature ejaculation, but selective dorsal neurectomy surgery can be applied just for the patients who are getting primary premature ejaculation. They use similar mechanism. In cryoablation, we ablate nerves of the penis. In neurectomy, we cut off them. How we are ablating the nerves? We are using some special probes which has -78 degrees of probe, and we apply that cryoablation, this special cryo treatment to nerves of the penis. We apply this treatment for the 4 nerves of the penis, 4 special areas of the penis, which is located on the dorsal part of the penis, which facing to our face, and we are doing it on the top part of the penis, and we are trying to ablate some of nerves. By the effect of the cryoablation, the myelin sheath, the sheath which is covering our sensory nerves of the penis, are destructed and they are degenerated. And after this degeneration, body regenerates its myelin sheath, but degeneration and regeneration phase generally takes around 1 to 2 years after the application. And regeneration is a millimetric procedure, and also regeneration is a millimetric procedure, and it takes time, slow and slow and slow. This slow regeneration time learns our body how to control its ejaculation. After procedure, 1 day to 14 days of the procedure, the patient starts to get benefit from the treatment. This is a local anesthetic procedure and non-surgical procedure. It takes around half an hour, and after half an hour you can go to your social life, you can go to your sexual life immediately. It can be changing after 2 weeks of treatment. After treatment, patients generally see benefit for 2 years. 2 years of treatment is crucial for us because we know that after 2 years of treatment, if you are getting benefit from the treatment, it can be lifelong effect or it can turn back to normal. In 8% of my patients, after 2 years, they do not want any extra procedure because regeneration and degeneration is generally slow and body adapts to new condition and knows how to control ejaculation, and male get confidence of sexual life after the procedure, and they don't go to their previous life before, and they go with a satisfactory sexual life. If they need an extra procedure, we can repeat it 2 years later, or we can just do neurectomy for those nerves because we are recording the procedures. We know which nerves we cryoablated before, and we don't have any surprise after 2 years of treatment because we are recording and we are preserving those records, and we watch again and see which nerves we ablated and what resulted we get from this patient before, and we can repeat procedure with cryoablation, or we can go through with the neurectomy surgery after by just cutting the nerves that we ablated before. This is an effective treatment. Success rates are over 85%, and this is a fast procedure. If you are getting premature ejaculation, primary, secondary, or if you are just in normal time or want to elongate your ejaculation latency time, you can contact my team and learn much more about these procedures and surgical and non-surgical treatment options for premature ejaculation.